Dr. Redlener, let me bring you in and Dr. Wen in on what it's impossible to cover this story in terms of statistics, in terms of numbers. These are human beings, and you heard the physician there, emergency room doctor there in the New York Times video report talking about how young they are, how they don't have other complicating factors. Can you take us through what may have been a misnomer, or just something we didn't understand yet, that many of the victims were otherwise healthy?
Yeah, of course, Nicole. This is something, every aspect of this was not really expected. It feels like years ago, but it was actually last week we were saying we're comparing what we're dealing with to the swine flu epidemic in 2009 or SARS in 2003. But in actuality, we're actually talking about the benchmark and the point of comparison being the Spanish flu of 1918, and none of us were alive to have experienced that. But this is what we have now, a monumentally difficult crisis with this particular pandemic. It's as big as it can get, and it's going to get worse. I used to be a pediatric intensive care unit director. You'd have a death, and it would be a tragedy. The idea of having makeshift morgues outside of hospitals and more reports of younger people dying, it's sort of dispelling a lot of myths now. We thought this was only going to be a fatality concern for older people with lots of pre-existing conditions. That's not true. And I'm hoping that we don't get to the point that may have been suggested by a couple of studies out of China that showed there are children, there are young children, who have gotten this disease. There's been at least 2 deaths reported among children. There may be more. I have no idea yet, but a 14-year-old and a 10-month-old, both with pre-existing conditions. But the fact is, we're just seeing the tip of the iceberg. It's also worth remembering, Nicole, this is not just an urban problem. It's mind-boggling to see what's happening in New York City and New Orleans and elsewhere. But I'm telling you, we are also beginning to see real evidence that this pandemic is affecting rural, isolated areas, small towns in Mississippi, and Arizona, and Idaho, and so on. I've been speaking to doctors in all these communities. They were already experiencing problems long before coronavirus with respect to insufficient access to medical care in some of these places. Now they're going to get a COVID-19 hit that's going to be just incomprehensible, but a lot more coming and a lot more reason to say we have to keep up public health strategies. Those are the only tools we have right now.
Dr. Wen, earlier this week, you made some very moving and to me surprising comments about being pregnant yourself. You've written a piece in the Washington Post about it. Take me through your piece.
Well, I'm almost 39 weeks pregnant as of the time that we're speaking now. And actually, I've been thinking a lot about this because healthcare continues to happen during a pandemic. People continue to get sick. They continue to have chronic medical conditions like pregnancy that they have to seek medical care for. And that brings up a lot of unknowns. And especially in this time when there are changing guidelines every day, it seems like new information is coming out. It just is a frightening time. And it is a time that prompts a lot of anxieties. And I know that with regard to, for example, my own hospital, we've just changed our visitor policies so that no one is allowed to have a visitor except for laboring women, end-of-life care, and children, which may well change. There are already hospitals in New York, as an example, that are not allowing any visitors even during labor and delivery. And I think this is just an example of how much uncertainty there is. And my heart breaks to think if I could not have my husband or anyone else with me during the delivery, but also how many sacrifices everyone is making at this time. People who cannot have a loved one as they are dying. People who are having emergency surgery and are terrified who can't have a loved one with them. These are just uncharted territory, and all of us are called upon to make these sacrifices.
And just the comments that we all listened to together at the top of the show from that physician in the New York Times clip. I mean, have you seen a situation? They described it in the Times on the front page of their report today as apocalyptic. Your thoughts about the emerging scale and magnitude of the crisis in New York City hospitals?
You know, I'm an emergency physician, and I was one of the physicians that treated the victims of the Boston Marathon bombings. And I I mean, that day will forever stay with me. Just the number of patients who are coming in and not knowing what was going to happen. I just can't imagine being in the situation now where every day is like that. And what these doctors are describing of not being able to protect themselves and also of rationing care, knowing that patients are dying because we don't have enough supplies. I mean, that's facing New York now, and it could well face the rest of our country unless we take the steps now to prepare. We're already weeks behind, and we really should not be in this position now.
Nicole?
Dr. Redlin, our rationing care and rationing equipment.
Yeah.
Let me just ask you, a bipartisan group of former national security officials writes in today's Wall Street Journal that the federal government needs to use the Defense Production Act now. How is it possible that we're so many weeks into this with the kind of deaths, with makeshift morgues set up outside of hospitals in New York City, and we haven't pushed every lever to make sure that sick Americans can get the care and equipment they need?
You know, you were asking me, how is it possible? I'm presuming that's sort of a rhetorical question. How is it possible that the President of the United States was suggesting that we could be starting to reduce the limitations on movement and sheltering in place by Easter? It's a preposterous statement, which can't happen. You know, and I think, listen, this is a situation, I think there's a concept that I wanted to share with you called crisis standards of care, which is something we started talking about in the late 2000s when we're talking about pandemic planning. Which means that, and really to emphasize what Dr. Gwen was saying, that we have a situation now where we're already changing the standards of care that we're able to provide, both because of lack of equipment, but also because of a tremendous overburdening, really apocalyptic invasion of our healthcare system by people with COVID. And it's not just those people that are going to suffer. It's people that are trying to come to the hospital because of chest pain, or they've had trauma that needs to be treated. They may not have COVID, but the healthcare system is getting so squeezed right now. I do worry about the care that those people are going to be able to get for other kinds of emergencies. You know, I have a son who directs I have a son who directs an emergency room in New York City. He's told his staff when they come in at the beginning of their shift to put on their gown, gloves, face masks, etc., and leave it on for the entire shift. This happened all over the country. You're supposed to be changing these things between patients, but we just don't have enough supplies to do that. So it's another example of this very severe altering of what we expect in normal times with good quality medical care. A lot of that is going to have to be put aside while we try to cope with this unimaginable emergency in our healthcare system.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.